Our next speaker is Rachel Schumacher. And of course, many of you probably already know who she is. She's another national leader who's probably as well known as Dr. Blair. Ms. Schumacher is the director of the Office of Child Care at the Administration for Children and Families, where she's committed to increasing access to high-quality child care that promotes early learning and development of children from birth through school age and in partnership with their families and communities. She leads the Office of Child Care's work in implementation of the Child Care and Development Block Grant of 2014, and through collaboration with the Office of Head Start, the Early Head Start Child Care Partnership Grants. Ms. Schumacher has served as an independent early childhood policy consultant and was a senior fellow in child care and early education at the Center for Law and Social Policy, most frequently known as CLASP. Ms. Schumacher has a master's degree in public policy from the Irving B. Harris School of Public Policy at the University of Chicago. And we are so fortunate to have Ms. Schumacher with us today. Please join me in welcoming her.
Hi, everyone. Can you hear me? Okay, so we're following a presentation of deep knowledge of science with a presentation that's going to touch on federal law. So you're going to have to bear with me because things could get a little detailed again, but we're going to take a little slight break from that now. So thank you so much, Cindy, for having me here, and to the NCPC staff for all the work they did to help get me prepped for this and get me here smoothly. I am the new director of the Office of Child Care. Many of you know my predecessor, Shannon Rudisill, who is a great mentor to me and who I very much feel like I'm following in big shoes. I started in December, 2 weeks after the president signed the CCDBG Act of 2014. You know, the law that was 18 years in coming, makes sweeping changes, improves the health, safety, quality of childcare in the country. So that was a big job, it's a big step. And 1 week into it, my boss, Linda Smith, told me, she's the Deputy Assistant Secretary for Early Childhood, I'm sure she's addressed this group. She looked at me coming late into a staff meeting and she said, you know, you can only say you're new for a month. So I hit the ground running because we have a lot to do in a very short time, and I know you all out there have been watching the progress of change coming our way for childcare, and you're as excited as I am about what the opportunities are, and so I'm here to talk about that today. But I can't call myself new, so if you hear me doing that, don't tell Linda. But. Okay, so I am thrilled to be here at the Smart Start National Conference. I have attended many times over the years, and it is really the most visionary and creative opportunity to reflect, I think, our field has now, and I'm so thankful for all of you being here and for the folks that put it on every year and for the folks who plan it. You know, when I have come to this, I always come away with new ideas about how to solve the early childhood puzzle, right? There's so many different pieces of the early childhood system, and we all know it continues to be a puzzle, and we have to find new ways to solve that puzzle. And looking at the sessions that you have here, you are going to be armed with all kinds of new ideas after you're through about how to use data creatively, about how what's going on the local level can inform the state level. And everyone who goes to that session, I know you're going to be really primed for supporting the state's child care and development plans that are going to be coming over the next few months. So we're all here for similar reasons, no matter what part of the puzzle that you currently represent. So I came here in a couple different facets before. Whether you work at a local or state agency, public or private, work primarily with children or families or with legislators, not sure which are more difficult to handle. Or even if you're a Fed, like me now, you are trying to fit the puzzle pieces together in new ways. You're looking for solutions in which the sum is even greater than all of its parts, and in which the needs of children and families come first. So listening to Dr. Blair and this very interesting presentation, I think some of you are familiar with this research before, and I couldn't help thinking about how critical this message is to get out and how important it is that we have scientists like him sharing this message and sharing it with you so that you can bring it out and put it into practice. I think last week I was on travel, but I was watching on TV, really concerned about the things I was seeing back home nearby in Baltimore and thinking about the stress that the children there now are feeling and the stress that their parents are feeling and the stress and the cortisone levels and all this implications of what Dr. Blair just shared for long-term regulation and how critical early childhood is to really the future of our country and making, knitting our country back together at the community level, and you all are so critical to that work. So Smart Start in North Carolina is where a lot of the great ideas that have fueled the early childhood field for the last 2 decades have come. Creativity, cross-sector, cross-pollination of ideas. So I started to reflect on Smart Start before I came up here, and I started to think, why are so many words that I want to use to describe this conference and the people who are here start with C? Maybe you can help me. I started to think about comprehensive. I thought change management, which is a skill that we're really going to need as we look forward to Child Care and Development Block Grant Fund implementation. Community, cultural competence. Anyone else have a C that comes to mind? I don't know why this is, but definitely there are a lot of words that describe what this conference means and what you all do every day, and I'm so thrilled to be here. So here in front of this very visionary audience, where I feel like I'm sort of coming home, frankly, I'm here to tell you that for the first time in a long time, childcare needs to be the central part of the puzzle you are trying to solve. Childcare and childcare policymakers need you as partners. They need your vision. They need your creative juices now. With the CCDBG reauthorization, we have an opportunity to push a tipping point for childcare and for the families that rely on it and shape the future of how this country really sees childcare. With the President's 2016 budget proposal, where he proposed a major investment in expanding access to high-quality childcare, we really have something new on the table. An investment in ensuring low-income families access high-quality childcare. It's been 18 years in coming, but it's on the table. And I'm asking you all to help. We all need to roll up our sleeves over the next few months. There are so many opportunities in this new law to take childcare to a new level, to connect children and families in childcare to the larger system, and really help children and families access the array of services that they need. It doesn't matter what the name over the door of the service is anymore. It really doesn't. It can be Head Start, it can be childcare, it can be pre-K. What we need to be thinking about is how to meet the needs of the children and families in those settings. And together, we need to make the most of the opportunity that's in this law. So first I want to go into talk a little bit about the vision that the administration has for carrying this into the future. And I'm going to do a little bit of physical activity with you too, because I know we've all been sitting for a while, so bear with me. So since coming into the office, this administration has worked tirelessly toward a vision of high-quality early learning opportunities for everyone, meaning that we're really changing and trying to walk the talk at the federal level. We're trying to work across systems more, and we hope that you see that. I know that for many, many years, folks in the field have been ahead of the federal government. You've been doing this work. You've been knitting things together, and the federal government has been sometimes a hindrance, not always a help, and we're really trying to change that, and we really want to hear when we're not helping with that. So the administration has been building these connections across programs, and I thought it might be helpful before we get into some details about reauthorization to think and reflect about some of the things that have come down the pike over the last few years. So this map shows the range of federal early childhood development investments by state. So this is, we have to stop and reflect. We should pat ourselves on the back. Many of you advocated for these things. Some of the things that came out of it really were ideas based on you. So 44 states and territories received grants for state advisory councils on early childhood, excuse me. So that is not reflected here, but that's a background, right? Then we had Race to the Top. 20 states have Race to the Top. So if you have Race to the Top in your state, can you stand up or wave or? A lot of you have Race to the Top. That's great. Feel free to actually do a wave if you need to get up, because I know that you've been sitting for a long time. I'm so thankful I'm standing right now. 18 states have preschool development grants, relatively new on the horizon. How many of you are in a state that has a preschool development grant? Fewer of you, okay. And then early Head Start childcare partnerships. We've got $490 million to 275 grantees that have just gone out. Every single state actually has a grantee. What you see on this are the states that have a state level grant. So we have Alabama, California, Delaware, DC, which I count as a state, Georgia, South Carolina, Pennsylvania. Are you from a state that has a state level grant for early Head Start childcare partnerships? Anyone? Anyone? I see just a couple people. Okay. So, and this also shows where, basically the idea of this is it shows where you've got more than one, right? So we have 10 states that just have an early learning challenge grant. We have 10 that have just a professional development grant. I mean, not professional development grant, sorry, a preschool development grant. You can see where my head is on professional development. We have 2 states with early Head Start childcare partnerships. We have 4 that have early learning challenge and early Head Start childcare partnerships. And we have several that have early learning challenge and professional and preschool development grants. And then there's some that have preschool development grants and early Head Start childcare partnership as a state level. But really, I show you all this just to sort of give a little context of what we've been trying to build from the national level, right? We've been working on trying to put out seed money that gets people thinking, that helps you in the trenches who've been doing this work for so long take things to another level, and we hope that that's been helpful. The other thing that has happened at the national level that's important to think about is that the federal government supported a new study from the National Academy of Sciences. Many of you remember how much Neurons to Neighborhoods really launched new dialogue about how the brain development was important for young children. Well, this new report is all about the workforce, and that's why I was probably starting to say professional development grants instead of preschool development grants. The workforce is such a critical piece of where we're trying to go with quality, and yet for so long it wasn't on the top of the agenda. And we now have a national report with really making the case, using the science and making the case for how important the adults that care for children every day in classrooms are, and how we need to nurture them, grow them, mentor them. And I think the word compensation is in there too, which is another C word that we need to remember as we go forward. So it's been an exciting few years. A lot has happened. I've come in a really fortunate time because nothing could have prepared me for what happened this January when the president gave his State of the Union address. The president said childcare at least 8 times. I don't know if anyone else counts in DC, you know, you do this game where you might take a drink or you might do something else. I'm not saying. When the president says your issue, right? I mean, because we're all crazy policy wonks up there. And the president said childcare so many times. If I had been doing a drinking game, which I don't do anymore because I have 2 young children who are 7 and 10, I would have probably been on the floor by the end of the game because that doesn't happen very often, does it? How excited were you when that happened? I mean, it was great. That's my boss. He really said, you know, it's time to stop treating childcare as just a side issue, a women's issue. It's time to treat it as the national economic priority it is for all of us. That was exciting to hear, and I think what was even more exciting was what he then announced, The president has put in his budget an $82 billion investment over 10 years to expand access to childcare, high-quality childcare for children under the age of 4 and who are under 200% of the federal poverty level. Now, this is a vision. We know it's a vision. It's a long-term vision. We have to work for it, but it's so wonderful to have it on the table. Okay, and the reason that we can do this is partially for what I'm going to spend the rest of the time talking about is the Child Care and Development Block Grant reauthorization. So Congress invested in this time in reauthorizing this law, and the president has now said, you think it's important? I think it's important. I'm putting something in my budget to really make this happen. This initiative would increase the average subsidy rate per child to $10,000 from an average right now of $5,500 per child. Okay, if you think about some of the things that we care so much about that were in those C's just a little while ago, compensation for teachers, a lot of the other things that we care about, quality standards, doesn't start with a C, but I'm still going to mention it. All of those things could really be fueled by this type of investment, right? We'd be looking at a lot more incentive to serve low-income kids and a lot more funding to those who are doing it. Because right now, if you're taking care of, say you're trying to meet early Head Start standards in your program, you've got 1 teacher to 4 kids. You're paying you're getting $5,500 a child for that. That's not enough money to attract the folks that you want to the system, right? $10,000 a child, it's getting more respectable. You have much more of a shot, and it really is intended to be something that would help providers do all the things that you all have been working for years in terms of improving the quality and really helping those teacher-child interactions be continuous, be quality, be stimulating, and promote the types of relationships and the type of expression and self-regulation that the previous speaker was talking about. The other reason that this is so critical is that, you know that map I showed before? There were some states that didn't get anything. Every state gets Child Care and Development Block Grant. Every state gets Child Care and Development Block Grant. Every state has an opportunity to take this new law and really run with it and do a lot of exciting things. Will Congress act? That depends, right? I mean, the president puts out a budget proposal. He has a vision. He's been doing some speaking about it. But part of what it depends on is how well the reauthorization is implemented and how much we take up the challenge that Congress has thrown down for us all to improve the health, safety, quality, and comprehensiveness of childcare. Can we do that? Sure we can. We can do it together. We have some of the greatest minds in the country right here who are working at the local and state level to help states do this. So we have a child care legislation that passed in a bipartisan manner, bicameral support, in a very partisan environment. If we can do that, we can certainly implement this law, and we can all do it and answer that challenge together. Another reason this is so important, as you all know, is that current spending for infants and toddlers by age, if you look at this slide, is so disproportionately lower, so much disproportionately lower than the potential impact we can have on brain development in those years. So the need is great. And the new proposal that the president has put forward, one of the reasons that it's going to be a challenge, I admit, to get it forward is that it will require states match, right? And we know states are struggling. But just like in the preschool development grants and the other opportunities I mentioned, it's a federal-state partnership. And the president has put something on the table that would refinance childcare in a federal-state manner to move forward an agenda that we all know is critical for young children. Why else is it critical? I mean, let's face it, the Child Care and Development Block Grant has lost its purchase power over the years. We are now serving fewer children on average than we did in 2008. It's been going down steadily. And the value of the subsidy has declined. The annual average subsidy in 2010 was worth $1,000 less than in 2003 when it's adjusted for inflation. And you know that. You can see it in your communities, right? You can see what's happening and how hard it is for folks to provide the kind of quality of care they want to. But now we have an opportunity to really make a difference, right? We have the CCWG reauthorization. We have a chance to really make a change. For those of you, so how many of you have maybe listened to the webinar that the Office of Child Care did on reauthorization, or heard some information from some source? Okay, so we have a lot of this is new. So that's good. We're going to spend some time talking about the reauthorization and why it's so important. The reauthorization passed, I said, in November. Was signed in November, and it renews authority through the fiscal year 2020. The thing that's really important to know, and I really want to stress and will mention over and over, is that the states have some time to implement, and they have some time to set out a plan and to tell the government, the federal government, how they plan to use their block grant funds over the next set of years. And the time that they are doing that plan is now. And in fact, we just gave them, the Office of Child Care and Administration for Children and Families just gave them a significant increase in time. And one of the reasons is because they said, we really need more time to partner. We need more time to work with people in our states and engage stakeholders. And that's people like you in this audience. So states are looking for that input and that support from you. We have answers to frequently asked questions on our website for those of you who want to look at those after this. And we are working frantically on trying to develop new regulations that would implement this law. Okay, this law doubles the size of the statute. This is a block grant that no longer looks as much like a block grant. There's a lot of new requirements in here that states are going to have to follow. And there's an incredible amount of opportunity to link to other systems and to further the systems building initiatives that you've been working on over the past decades. I always like to start by talking about the purposes of the Child Care and Development Fund, because Congress changed them significantly. And they put in some really exciting things that you might have thought were in the purposes of the Child Care and Development Block Grant, but weren't. Things like the importance of promoting involvement of parents and families in the development of their children in child care settings. They put in language around delivering coordinated, high-quality care, improving the overall quality, improving child care and development of participating children, which is the thing that we're really excited to see in there, right? And increasing the number and percentage of low-income children in high-quality child care settings. And I keep returning to that theme when I talk with the states, and they keep saying to me, what does this mean? How are we going to measure this? And that's something that we really need to keep talking about. That metric, if it sounds familiar to you, so many of you raised your hands when I said Race to the Top Early Learning Challenge. That's a metric in Race to the Top, right? In Early Learning Challenge, getting more low-income children into high-quality care. So you can see how the Child Care and Development Block Grant reauthorization complements and reinforces the things that you have been working on. So there are many key features of reauthorization, as I said. Reauthorization, the legislation is quite lengthy. I think some sections are lengthier than others, but even when we start looking at them, we keep finding new things. So that's why we're in the process of developing new regulations. It ranges from subsidy policy to tribal provisions, as you see here. It touches on quality, it touches on payment rates to providers, it touches on all these things. And it's really worth it to take a look and walk through and figure out where it touches something that you care about and you work on. And I've tried to anticipate some of that in my presentation, but believe me, I cannot do justice to this law. There is a lot in there. So I hope you do look at our website if you're interested in more information. Given the large scope, the broad scope of this legislation, we see tremendous opportunities for impact that we really want folks to be thinking about in the field. We have 1.5 million children in an average month receiving subsidy. We have all the families that are bringing those children to settings every day and an opportunity to interact with them in a new and different way and engage them in the development of their children. We have teachers and providers around the country who are receiving subsidies who could potentially see increases in their payment rates based on some of the provisions in this law. And new efforts to calculate what the cost of care is versus just looking at market rate. And last but not least, communities. Because a lot of what is in here, and the states know this and they want folks at the local level to be engaged with them, a lot really happens on the community level, right? If you're really going to talk about connecting the children in a child care setting and their families to the other community services available, that takes local coordination and local integration of services and referrals and warm handoffs and all the things that we know make those real connections. And you can be very integral in helping states with their planning by pointing to what's worked, sharing lessons learned, talking about a model in your state that potentially could go statewide and might be helpful for them to know about. So we do really want you to be thinking about those things over the next set of months. And so the other thing that the states and I have been talking about, and we've just had a series of meetings around the country in the last month where I've met with all the state administrators around the country, is to really engage partners, as I said before, and they know this, they've been talking to me about, you know, I have to talk to my licensing agency, they're not in the same agency, and to make these changes, I need to have my licensing agency on board. Or, you know, there's options in this law to talk about quality childcare and how we get that information directly into the hands of recipients for subsidy. Who's my partner? We have an R&R, we haven't done that before. We never asked them to do that before, but now we think we might. So there's an opportunity there. They also need to talk with the folks that do developmental screenings and early intervention, right? Because those are other opportunities I'm going to get to talk to you about in a minute. There's a new provision in the law. If you have tribes in your state, tribal leaders are supposed to have an opportunity to be engaged in the planning of state plans and should be part of the picture if they are interested. There's provisions in this law that touch on all the array of other programs that families may be eligible for. And there's other provisions around nutrition, and you can see higher education, professional development, child welfare. There's a whole section on background checks. So these are all the little nitty-gritty details and all the partners that can help people get there. And what we really are hoping is that the vision doesn't get lost in all these details, right? And that we're all still pushing towards what we really want for children and families and thinking about, are there handles in the new regulations and law, regulations aren't out yet, in the new law, that encourage us and help us think about where we can go, that signal that this is something that is going to be important in the future through Child Care Development Block Grant. And if there are there opportunities to really run with that? And we are working with our technical assistance network to support states and to work with them on identifying new opportunities and ideas and linkages and resources. So we're always interested, and those folks out there are always interested in hearing where things are working at the local level. So one of the things that I am most excited about, and I think when I came on board, one of the first executive actions I did was rearrange that list of all the bullets that you saw when I had all those things that reauthorization did, because I love to talk about the subsidy program and how the subsidy program really is an opportunity to promote quality. For many, many years at the Center for Law and Social Policy, we were writing about there's a 4% quality set aside for, yes, that's really great, and it's important that we think about how we use that. But the other 96% is pretty important too. It's pretty important. Because how you set rates and how you pay providers and what you do in terms of subsidy redetermination timelines all affect the access that children and families get to high quality providers and the continuity of care that they can receive. So the new law has a very exciting provision. It says that children and families can remain eligible and receive services for no less than 12 months, so long as their income remains below 85% of the state median income. How many folks here know that their state has a 12-month redetermination period that would meet that particular standard? Anyone think they have one? Okay, so this is really a sea change, and we're really trying to collaborate with states on how to figure out how to implement this in a way where we are recognizing the implications for waiting lists and things like that. But this is a line in the sand that Congress has drawn around continuity for families. Another thing is they did give states the option to terminate assistance before the 12-month period if the parent loses employment or ceases education, but then they must allow for a 3-month job search period. So that's a real sea change too. And so with the other provisions around here that you can think about for continuity of care, this provision around graduated phase out of assistance, which is a term we're all puzzling over. If anyone spent time looking at the law, you might be puzzling over it too. You can come talk to me afterwards and tell me what you think, because I'd be interested. But we're really looking at this. It's really talking about the opportunity in a graduated phase out assistance is really looking at both the co-payments and the income level of the family and thinking, I challenge folks to think about what would it take to support a family until they actually didn't need assistance, assuming that would be somewhere between where they enter and 85% of state median income. That's a real difference. That's what the child care program should be doing, right? It's really helping folks get to the point where they don't need assistance anymore. So we have an opportunity to think that way. And last but not least, eligibility redetermination is not supposed to require parents to unduly disrupt their employment. I think there's a lot of good resources that have been written on that and how that's important. So another area to think about is the equal access for high quality, low income children that I talked about before. So there's 3 pieces I want you to think about. And one of them is particularly important for you at the local level. And that's the third one. But just really quickly, there's a provision that allows states that's going to require more that rates get moved at the same time that new rate surveys are done, but also allows states to use an alternative method of calculating payment that could be really tagged to the quality improvements or the types of care that you see that you want to encourage. There's another provision around provider payment practices, I already mentioned that, and really looking at what's generally accepted. For example, when you're a private pay parent, how many of you get to pay after the fact and just take out the parts where your child was sick? Anyone get to do that? I didn't get to do that. I have 2 kids and I didn't get to do that. So, those are the kinds of things that are now on the table to look at and really think about changing the structure of the system. And the one that I want you to think about particularly, and I challenge you to think about, is this building supply for underserved populations. States have to develop strategies to increase supply and quality for children in underserved areas, infants and toddlers, children with disabilities, and children in non-traditional hour care. So that may include use of grants or contracts, which is another way of paying besides vouchers, and other types of alternative payment strategies. So think about what this means in your community. Do you have data that you could share with your state about underserved populations, where they are, what they need? Later I'm going to talk about some changes that are going to happen with requiring background checks and requiring new health and safety training, even for license exempt providers. And there's concerns that that's going to mean that there are fewer providers, that some of those providers drop out of the system. Well, if that's going to happen in your community, let's document it, let's talk about it, let's get ahead of the curve by developing new supplies of care in that community, and maybe using grants or contracts, which is something that I won't get into the details, but happy to talk about with folks if they're interested. So I do hope that that's something that you would take a look at, given your local expertise. Another area of the law that I really think is important, and I don't know, how many folks here are from a resource and referral agency? Quite a few. Okay. So the state now has a whole host of new requirements around collecting and disseminating information, consumer education information to parents who receive CDF, the general public, and where applicable, providers. So there's 3 groups now where there weren't before. This is really new. This section is huge. And consumer education isn't just about picking quality childcare anymore. Not that that's something that we should take off the table. It's in there and it's very critical, and we know how important it is to link that to quality rating and improvement systems if you have them. But it's also got all these other topics that states are going to be needing to think about how to answer. It ranges from pre-K expulsion policies and whether they have preschool expulsion policies for childcare. It ranges from that, to things like encouraging information about developmental screenings to get out to folks who are using childcare. It's a tremendous opportunity. This is what we mean when we really think about changing what access folks in childcare programs have to the larger system, building into the larger system of what's out there. And this may be done through resource and referral agencies or other means that the state determines. But R&Rs, we really urge folks to think about how you can be helpful with this, because you are so much closer to the folks at the local level. You have connections with providers, you have connections with parents, and hopefully you'll have an opportunity to partner with the state to think about how we can really meet these standards and get these types of pieces of information into folks' hands. So I inadvertently left off a slide about consumer education and quality. There's a set of opportunities around that and the kind of information that needs to go to parents and providers and the general public, some of which I touched on. There's the information about choosing quality care and the information about social emotional development and whether the state has a policy on preschool expulsions and what it is. Those are things that we will be asking at the federal level in the Child Care Development Plan. Please tell us about these things. And some states may not have them, and that's something that it remains to be seen whether the federal regulations will address whether or not these things have to happen, but that doesn't matter because the frank fact is that they're going to be asked. And they're going to want to have help. And they really do need your help in these types of things. Another area I really want to stress for this group is thinking about consumer education and linkages to services. The law says that these pieces of information need to be provided to parents who are receiving subsidy, to the general public, and where applicable to providers. And that's a real opportunity, right? Because providers are going to be the great person that sees that parent every day and can share information. They can be trusted messengers of information, and they also are the gatekeeper for services for their child. So some of the pieces that need to be made, connections that need to be made now are around a range of financial assistance programs you can see here. Programs that are carried out under IDA, Parts B and C for special needs and early intervention. And I keep mentioning, because it's one of my favorite issues from when I used to work more on the outside with communities around the country, is getting developmental screening information into the hands of parents and providers would make such a difference for our young children around the country who may have delays that don't get identified until it's too late to really prevent some of the school readiness issues they might have when they get to school. So we have an opportunity to really think about how to do this for families that are entering into the child care system and families in general. And we'll be asking about it in our plans. So we'll be really interested to see, do you have a local model that you could share with your state? Please think about these things. So the next slides are about the health and safety provisions that are in the law. And again, I'm not going to spend a ton of time on these because frankly, this is where everyone is really thinking about already, I think, at the state level. But if you have things to add and help, please do think about them, right? So we're going to have 10 specific health and safety areas that need to be trained and need to have requirements for CCDF providers. That's new. We're going to have states needing to explain why, if they choose to exempt certain categories, why they do that. We're going to have criminal background checks required for all child care providers and staff members. And relative caregivers can be excluded from the first and third bullet. And last but not least, that states have to make available by electronic means, which we interpret as a website, not sure why they didn't say that, provider-specific information showing research results of monitoring and inspection reports. So transparent information, kind of like when you go to buy all kinds of things, right? You get a little piece of paper, or you get some information that tells you, how it's rated. You can look at consumer reports. There's really an opportunity to think about consumer reports for childcare through this legislation. There's also new requirements for monitoring, and as I said before, this is where a lot of the states are really focusing a lot of their energy already. They're really thinking about, meeting these requirements for pre-licensure inspection and unannounced and announced visits, depending on the type of care, on an annual basis. It's going to cost a lot of money. We understand that that's something they need to think about, but we also are encouraging folks to think about differential monitoring. We're encouraging folks to think about how you interact with license-exempt providers, especially home-based, might be a little bit different than you interact with a center that's been licensed for years, and that's something that folks can think about. It may be that resource and referral agencies could help with some of this, right? Community-based organizations could help with some of this. So there's a lot of creative thinking to solve this problem that you can help with. Another area of the law that is something that you probably are all already thinking about in your everyday work is family engagement. I've touched on it a couple times. There's new language in the purpose. There's language in consumer education that it has to include information around early childhood development and meaningful parent and family engagement. And there's also, in the quality area for professional development, there's training and outreach on engaging parents and families in culturally and linguistically appropriate ways, which we all know is really critical for our changing child population and family population. And then there's a section of the law, and there's more, I feel like saying. There's a section of the law on the professional pathway for providers. So I mentioned before that new study we have on the workforce that's really taking a national lens on the workforce and having a science body get behind what we've been saying for years, how important that relationship is for young children. And we have this new language in here requiring a professional development and training requirements to improve the knowledge and skills of providers. And it talks about an ongoing annual training and a progression of professional development. A progression of professional development, that sounds like a professional development system. That sounds like a career ladder to me. That sounds like something that should be linked up to QRIS, to your professional development registries, to all the other things you've been building over the years. And it also needs to include a focus on social emotional behavior and intervention models, which is exactly what Dr. Blair was just talking about. I keep getting your name confused. This is really some tremendous new ways of thinking about what professional development does. It's clearly not just about one-off workshops anymore. They're talking about something that builds. Oh, wait, let me go back. Oh yeah, so there's also a new list of quality activities specifically identified, and it includes professional development and provider accreditation as allowable activities. The quality set aside is going to go up over time, and I'll show you a chart on that in a minute. And the other new thing to think about with the quality money that those of you who are the folks here who are going to all the data sessions can think about, states will need to do annual reports on how their quality investments are moving them toward progress for improving the quality of childcare. So that's something to help them think about too. And it is something that I think you all probably have a lot of experience looking at the local level. You're probably very used to trying to figure out how to measure your outcomes. And it's something that they would probably be interested in your success and what you've done. And then I mentioned this before. This idea of improving access for underserved populations. The one population I didn't mention is the homeless population. So there's several different provisions in the law around homeless populations. If that's a group that you have in your community and you're working with, it's going to require states to establish procedures for enrollment of homeless children pending completion of documentation. So you know when you're homeless, you might not have your immunization records, you might not have your most recent wage statements. All these things you might have left behind because you were escaping a domestic violence situation or a fire or whatever it is that made you homeless. And this is going to make it easier for those families to become enrolled. It also talks about children with disabilities, gives a statutory definition, and requires greater coordination greater coordination in providing parents with information and access to services. So that's why we have those IDA partners on the list. There's a lot of partnerships that need to happen here. And I already mentioned supply building, which is something that I think you all could help with a lot. So effective dates. Congress put a lot of very specific effective dates and some less specific effective dates in the law, but all of them are going to need to be explained. All of the provisions I talked about will be addressed in the Child Care and Development Block Grant Plan that your state is preparing and that you can be a part of. Some of them, they'll just be describing their implementation plans because the effective dates are coming forward. So one thing that's going to happen pretty quickly is the quality set-aside is going to go up in 2016 to 7%, and then there will be an infant and toddler set-aside separate and apart from that. So that will be happening over time. The other thing, these are some of the other effective dates about criminal background checks, monitoring, posting results of monitoring and compliance for priority services. These are all things that your states have, are really on their minds because there's really specific dates and they really are worried about it, and any help you can give them, I'm sure they'll appreciate. But where the law does not have a specific date, what we've decided is to give states and territories time to figure out how to do this, and they're going to be explaining that in their plan. So they must submit a state-specific implementation plan for achieving compliance, and they have to provide sufficient information. So even if you've done a lot of implementation planning, this is an area you can probably jump in and help with. They're going to be laying out their tasks, their goals, how they're going to get there, and the timeline. And the federal government will be going back and working with them at least every 6 months to see how they're doing on their plan. And they have until the end of 2016 to implement those other things. So, in conclusion, I'm going to leave you with some thoughts for consideration. I think it's really, really critical that you all are involved in this process. I'm so excited for what you bring to the process, too. I'm so excited for how you can help my state administrators, who my heart goes out to because I know they're working so hard right now. There's an opportunity here to make lasting change in early childhood. There's more political will at the national level, as Cindy was saying before. In January, we hosted this panel of congressional staffers to address the state administrators, and they basically indicated that they think they fixed the problem. They fixed childcare. That's good, because that means it's a program they might want to invest in. And so our challenge, the ball is really in our court now to really meet that challenge and figure out how to implement this law as best we can. And I know, because there's 32 states covered here by who's attending, that those 32 states are all going to do a great job, because you're going to go back and you're going to really get involved. We can do this. We have to. We're setting the stage for a really important new era in childcare. So these are some considerations for you to go back and think about. How you can push a systems agenda, how you can support the CCDF plan development, how other federal, state, and local early childhood initiatives inform what the state develops and can be furthered by new opportunities in the law, and are there your local best practices that could inform the process too, and what can you share? So I'm going to conclude now. I leave you with this. I thank you so much for all your hard work, everything you do for children and families. It's much appreciated from us up at the administration, and we do want you to stay in touch. Please do go to our website, which you can see at the bottom, and there's ways to sign up for updates for us now. You can click on a button and get updates whenever we change things, and that's how you can get direct information about the things that we're telling states and the regulations, and the new Child Care and Development Block Grant Plan draft, which should be up online this month, that you can take a look at. So we do hope that you take an active role, and we appreciate so much everything you do every day. Thank you.